Nelson Mandela, who seems to be on life support at the moment, did say when he wasn't on life support that there is no keener revelation of a society's soul than the way it treats its children. And there's the old Indian proverb, to plan for a year, sow a rice paddy field; to plan for a decade, plant trees; to plan for the future, nurture children. And I'm sure everyone will be very supportive of those sentiments here today. So I want to say just a little bit about the nature of poverty, about child poverty in New Zealand, why we should be concerned, what the expert advisory group did and said, what the government has said in response, sort of where we're at now, and then offer some reflections on policy making with respect to the issue of child poverty. When we think about child poverty, obviously many of us will immediately think of abject poverty, serious childhood deprivation, malnutrition, starvation, and so forth. But of course, in the New Zealand context, as a developed country, we're primarily concerned with relative poverty rather than, if you like, the most abject forms of poverty. That's not to say that children in New Zealand don't go without some of the basics of life from time to time. It's not to say that children in New Zealand don't suffer from periodic periods of hunger or that they don't live in overcrowded or totally inadequate housing. And indeed, Philippa, I know, has supervised a PhD student who may be here today, who's just done a fabulous piece of work on the whole area of homelessness in New Zealand. But basically, when we're talking about poverty in New Zealand, we're primarily concerned with relative poverty. So we're primarily concerned with children being unable to fulfill their potential fully, missing out on some of the things that most people would regard as essential for a fulfilling life. And there are two ways in which we tend to measure relative poverty in developed countries. There's income-based measures and deprivation-based measures. Both are important, both highlight different aspects of poverty, and I'm going to be saying just a little bit about each of those measures over the next few minutes. There's no one correct measure of poverty, and indeed in our report to the Children's Commissioner, we recommended a structure of at least 5 separate measures of poverty, which include both income-based measures and material deprivation measures. As you know, I'm sure New Zealand doesn't currently have official poverty measures. Only a few OECD countries do, but we certainly think there should be official poverty measures. The best work on poverty, including child poverty in New Zealand, has been done by Brian Perry in the Ministry of Social Development, and we owe Brian an enormous debt. And he has tracked over a number of years now trends in both income poverty and material deprivation. And what that data basically shows is that income poverty in New Zealand, using comparable OECD standards, is roughly around the sort of mid-range of OECD countries, perhaps a little bit above the OECD average, depending on the measure used. But material deprivation rates for children in New Zealand are higher, certainly than the averages in Western Europe, lower than the averages in Eastern Europe, but that of course reflects standards of living amongst other things. The data also shows very clearly that our deprivation rates for children are higher than those for most other groups, and indeed child poverty rates are higher than typically for other groups, though 18 to 24-year-olds are now have income poverty measures close to those of children. Many of you will be familiar with this sort of diagram, which shows the poverty rates using an income-based measure based on those below 60% of the median disposable household income after adjusting for housing costs. This shows that particular poverty measure for 5 different age groups. The blue line is children, that's 0 to 17. The black line at the bottom is those age 65 plus. The dotted red line is 18 to 24-year-olds, and the other groups, as you can see, in between. Just very quickly, what that highlights is that if you went back 30 years, poverty rates in New Zealand were relatively low. Child poverty rates were in the vicinity of 11 to 15% during the 1980s, averaging around 13%. Income poverty using this measure for those 65 plus was in the vicinity of 5%. Poverty rates rocketed, particularly for families with children during the late 1980s and early 1990s. The main reasons were the very substantial cut in welfare benefits, the very substantial rise in unemployment, and a general increase in the numbers of sole parents over that period. And you can see that over the 1990s and into the early part of the century, we had child poverty rates on this particular measure close to 30%. They came down as a result of working for families and higher levels of employment during the mid part of the last decade, and in the last few years have risen again to around 25% for children. So that computes to around about 270,000 children using this particular measure. This is a slightly different measure looking at the both fixed line and moving line measures of poverty, again using the 60% threshold after housing costs. The blue line shows you the constant value measure using 1998 as the benchmark year, and it basically highlights that using that standardized constant value measure, if you take 2007, the proportion of children in relative poverty on that basis was greater in proportional terms than 25 years before. In other words, there were more children worse off on the same real standard of living than 25 years previously. I mean, that is quite shocking when you realize that actual average standards of living had gone up substantially during that 25-year period. Depending on the measure, you can get numbers of children in poverty between about 170,000 and 270,000. Using income-based measures, using deprivation measures, you can get different numbers, but on a European Union official measure, we're around about 200,000. Just to compare very briefly with Australia, a very, very different profile over the last 20, 25 years. Basically, child poverty rates have gone down in Australia, whereas if you look at the same data in New Zealand, they've gone up. I won't spend a lot of time on this, but essentially the Australians have devoted a very substantial amount of resource to reducing child poverty, and that's been the case under both centre-right and centre-left governments. And they've been relatively successful. So just a few words about the nature of child poverty in New Zealand. Essentially, child poverty is concentrated in families with young children and in larger families, in the families of beneficiaries. But we should also note that around a third of children in poverty are in households where at least one adult is in full-time employment, so that highlights the problem of low wages, amongst other things. And of course, as many people here I'm sure know, Māori and Pacifica families experience child poverty rates of double to 3 times those of Pākehā families, depending on the measure of child poverty used. So we have, a pretty substantial problem of poverty among children, and we know roughly sort of where it's located. We also know that significant numbers of children spend long periods of time in poverty. So more than half of children under the age of 15 spend some time in families supported on a main benefit. Around 6%, that's 50,000 children, spend 13 to 14 years in a benefit-supported family. And if those benefits are low, as they tend to be in New Zealand, then that means they're spending a long time in low-income circumstances. And around 21%, or 180,000 children, spend more than half of their first 14 years in a benefit-supported family. So we're dealing with, substantial numbers of children experiencing persistent or intermittent, but certainly protracted periods in low-income households. Now, another way of measuring poverty is through material deprivation measures. This is where you basically ask people, what do you think people need in order to live a fulfilling life or in order to meet certain acceptable standards? And those items which the majority of the population think ought to be included as essential, like having your own bed, having a raincoat, having sturdy shoes, being able to heat your home, etc., those items which the majority of people think are essential are deemed to be essential. So obviously that standard is going to vary between countries and over time depending on the results of surveys. You then take those items that are essential and you ask people, do they have them or not? And if they don't have them, you ask, do they not have them because they can't afford them or because of other reasons? And when they can't afford items that are deemed to be essential and they don't have them because they can't afford them, then people are deemed to be deprived of those items. This is an Australian list of essential items based on survey work in Australia. The items at the top are those which are deemed to be most essential. The ones at the bottom just make the cut of over 50% of people thinking they are essential. The highlighted ones are child-specific items, so you've got things like a separate bed for each child and so on. And the numbers in the columns represent the proportion of children in 2006 and 2010 who are lacking those items. And you can see that for the majority of those items, very few children were lacking those ones, particularly near the top. But there were significant numbers of children lacking things like, yearly dental check and so on. Now, for New Zealand, using the European Union 9-item index, if you make the cut point for deprivation as being at least missing out on at least 3 of 9 essential items, then this is what you get. Many of you will be familiar with this, so again, I'm not going to spend too long here, but just to highlight that for New Zealand, on that basis, in around 2007, 2008, 18% of children were missing out on at least 3 of 9 items deemed to be essential, and that list is the European Union's official deprivation list. By comparison, only 3% of people aged 65 and over. So very, very different profiles of deprivation across different age cohorts in New Zealand. And you can see the numbers for other jurisdictions. You can see for most Western European countries, child deprivation rates were lower than those in New Zealand. But if you look at countries like the Czech Republic, and of course if you went further east into Poland and so on, the numbers would go up quite significantly. All right, so obviously many families in New Zealand are poor. Why is that? Well, it's partly parental unemployment or underemployment, it's partly low wages, and it's partly the design of government policies. And I'll say a bit more about the policy end in a moment. But essentially, we've made the decision to set our benefit rates at relatively low levels. We have a problem of the family tax credit system delivering proportionally more assistance to small families than larger families, and more money to children in their mid-teens than to families with young children. We have particular child support arrangements which basically mean that lots of beneficiary families see no benefit from the child support provided by the non-custodial parent. We have low take-up rates for some forms of assistance and so on and so forth. So there's a variety of problems in the policy area. Why should we be concerned about child poverty? Well, there'll be many people in this room who know vastly more about this, but essentially we're dealing with a condition which generates harms, both harms to individuals in the form of worse health outcomes and so on, worse educational outcomes, but also harms to the wider community as a result of the negative impacts of poorer educational performance and poorer health on things like labour productivity, levels of employment, levels of earnings, and so on. So there are both, if you like, reasons for concern based on concern for the individuals that suffer as a consequence of childhood poverty, but also reasons for concern based on the damage done to the wider community. Coming then to the expert advisory group, as Philippa mentioned, it was a group of 13 people established beginning of last year by the Children's Commissioner, Dr. Russell Wills. Those 13 included academics, people from the voluntary sector, a leading business person, Phil O'Reilly, Chief Executive of Business New Zealand, and so forth. We had quite specific terms of reference which were focused on providing advice on how to reduce child poverty, but also how to mitigate its negative impacts. We produced 2 reports, an interim report and then a final report. This is the final report, but also around 24 working papers and 4 other background papers were provided by others. And I really do want to pay a special tribute to those in this room, including Philippa, who worked very long and hard to help us with some of the the working papers. So there's a massive material there. We deliberately kept our final report short. We were told we couldn't go over 80 pages, and I'm very pleased to say we kept it exactly to 80 pages, on the basis that people don't read much beyond 80 pages, and that if we wanted to have an impact, we needed to be short and pithy. So if you think that it's a very thin report, well, it is, but that's deliberate. So we concluded our work in December last year. We undertook a consultative process. We met with ministers and officials on a number of occasions. And in fact, we had very considerable support from a number of government departments. Thinking about the sort of approach we took, we were very mindful of the political context. The national-led government was not particularly sympathetic to the initiative that the Children's Commissioner took in establishing the expert advisory group. And it was pretty clear that the government was also internally divided, both in terms of the National Party, but also obviously between the National Party and some of its support parties, about what response to child poverty there should be. We were also operating in a context where the Child Poverty Action Group was very active, where there'd been recently established the Every Child Counts initiative, and where there was growing debate about income inequality, and where I think a growing number of people across, if you like, middle New Zealand, including some leading business people, were beginning to take child poverty and its consequences more seriously. Having said that, it was very evident too that public opinion was divided, lots of myths and misconceptions. That was very evident from going up and down the country talking to community groups, just the sort of level of I think, misunderstanding, misconceptions, but also sort of very negative and quite punitive attitudes towards the poor. It was evident that officials were divided about whether the government should be doing more about child poverty, and within the Treasury, which of course is our most important player in the advisory process, I think divisions of opinion as well. And the Treasury, being the Treasury, decided to do its own report on child poverty, largely ignored what we said. Their work is online, so you can see that we rated a mention in their work, but only a mention. It's always very humbling. Anyway, we were also faced with a context where we had quite deliberately a diverse group of people in the expert advisory group, and where we were thus divided on a range of issues. How ambitious should we be about reducing child poverty? What sorts of instruments should we be seeking to use? What attitude should we have towards particularly the contentious in-work tax credit, which has been the focus of a lot of attention from CPAG? What attitude should we have to the employment of sole parents, bearing in mind that sole parents are absolutely fundamental to addressing child poverty because of the proportion of children who are in sole parent households on low incomes. And then there was a range of differing views on other policy areas like housing and education and health and so forth. So from my perspective as a co-chair, there was a difficult juggling exercise to undertake. And we recognised that we need to produce a report that was going to serve the interests of multiple audiences, a report that was going to be acceptable in some respects at least to the current government, so it had to be fiscally prudent, it had to be practical and feasible and so forth, but also we wanted a report that would highlight what we should be aspiring to do in the longer term, potentially under a different government that might be willing to take more ambitious steps to address child poverty. So, cutting right to the chase, we adopted the following sorts of considerations. We accepted the complexity and of the issues we're trying to address. We thought it would be more sensible to try and build on current government policy initiatives rather than to sort of say, you're all wrong. We wanted to draw on the very best available international and domestic evidence on what works, what's cost effective. We wanted to propose policies that were consistent with well-established ethical principles and considerations. We obviously wanted to both reduce child poverty and mitigate its effects. We recognised the need for both action on incomes as well as in-kind assistance. We recognised the need for both an employment strategy and an income sort of supplementary strategy. And as a result of all that, we obviously recognised the need to have quite a few recommendations across multiple areas, and in the end, we had 78 recommendations. The core messages were that child poverty can and should be reduced, that we need a strategic approach, and we recommended in specific terms that we should have a Child Poverty Act that would require governments to announce periodically a strategy for dealing with child poverty. That strategy would need to include clear targets based on the 5 or 6 measures of child poverty that we identified that we should have, covering income, deprivation, severe and persistent poverty, and so forth. And we recommended that there should be, within that Act, a requirement for regular monitoring and reporting of progress in relation to reducing child poverty and mitigating its effects. We also recommended that there should be a significant range of what we call child poverty-related indicators, CPRIs. Specifically, we recommended specific reductions in child poverty over particular periods of time. There was a lot of debate about whether those targets were sufficiently ambitious, but we wanted to be realistic, as well as setting some more long-term demanding ambitions. Cutting to the chase, if you wanted to get a family of 2 children and 2 adults who are currently on around 50% of the median disposable income, up to the 60% of median disposable income, you basically got to increase their incomes by around $100 a week. And so the question was, how did you do that? Bearing in mind we've got about 16% of families below the 50% measure. So even if you got those on 50% to 60%, you'd still have a significant number of families below the 60%. So the question was, how do you get a boost of at least $100 a week in household incomes, plus or minus, depending on the size of the household? Well, we said we need a mix of strategies. We couldn't just rely on income support, not least because of the fiscal costs associated with that. So we recommended a range of measures to boost incomes, which would include measures to boost incomes through greater levels of employment, particularly among sole parents. We also recognised that there was a need for additional in-kind support of various kinds, and we can talk more about that later, but through the work of people like Philippa and so on, we put quite a lot of effort into thinking about how we might improve the quality as well as the quantity of affordable rental housing, which means doing something quite significant about the private housing rental market, as well as increasing the quality and quantity of social housing, and so on and so forth. What was the government's response? Essentially, the government responded positively to around a quarter of our recommendations thus far, and is looking at reviewing some of the others. But it's fair to say that none of the recommendations relating to income support, which includes child support, have been adopted thus far. Though I am hopeful that in the forthcoming budgets under this government, assuming this government survives for some more years, there may be measures to take on board at least some of our advice with respect to the structure of the family tax credit. In other words, I think there is a recognition in the government that there is a case for increasing the level of assistance to families with young children and to families with more than 2 children. So I'm hopeful that more of the recommendations will see the light of day, even if there is not a change of government. So just some quick reflections on sort of policy making in relation to child poverty. First of all, we need to recognise the political economy of this. Children don't vote, though of course their parents do, though many poor people don't vote, of course, to the same degree as better off people. We need to recognise the ethnic dimensions of this and the framing issues that gives rise to. It's very clear from my involvement with public meetings that many people see child poverty as a black or brown issue rather than as a white issue. And by seeing it that way, there's a risk that people will pigeonhole things and will frame things in such a way that poverty is associated with their children, not our children, and then that, of course, has ramifications for how people feel about taking action to address it. We have limited leadership politically, particularly in the major parties, on this issue. To the extent that there's any champions, it's sort of the Greens and people in the civil society organisations. So we need to do something about that. We obviously need to do something to change public attitudes, values and priorities. It seems pretty clear to me that many New Zealanders are ready to tolerate quite high levels of child poverty. Well, we have, for 25 years. That's a long time. And there is certainly evidence, empirical evidence, that support for income redistribution, progressive taxation, and so on has declined quite significantly in New Zealand over the last 25 years. When Ruth Richardson said she wanted to change the hearts and minds of New Zealanders 25 years ago, well, she has. I mean, she's been successful, and that has had consequences. The question is, how do you change hearts and minds in the other direction? Aristotle talked about logos, ethos, and pathos. In other words, using reason, ethical arguments, and emotional appeals. Well, I think we have to do all three, but it's going to be a long, hard slog. And, of course, people in this room can help enormously, particularly on the reason end, with the evidence. So I've exhausted my time. Just to quickly wrap up, it's pretty clear that child poverty in New Zealand is a serious issue with long-term economic and social implications. We need to do something about it, both from the point of view of just genuine ethical concern for the least advantaged and vulnerable members of our community, but also from a purely enlightened self-interest perspective. It's to our mutual advantage to have children flourishing, because then they will, in their adult years, do better, and we as a society will do better. The level of child poverty is clearly a matter of policy choice, at least to some degree. We can choose what level of child poverty, on the various measures that we have, what measure of child poverty or level of child poverty we want. It's clearly open to policy fiddling, if you like, at least to some degree, but we have to want to make a difference. We've clearly tolerated significant levels of poverty for some considerable time. We have to ask ourselves, why is that? Well, I think it does reflect attitudes and values. If we're going to do something about it, obviously we have to raise incomes, particularly for low-income households with children, and we need a mix of measures to address that. But we also need to address some of the deeper, if you like, longer-term issues around our economic performance as a country, about how income and wealth is distributed in this country, about family functioning and the fact that we have a very high level of sole parenthood in this country, and we have among sole parents a relatively high level of unemployment and underemployment relative to many other OECD countries. So there's some serious issues there that need to be addressed that go well beyond the issues of child poverty. So thank you, Philippa, and very happy to take questions later on, but I'll now turn to Archie.
I'm also a bit overawed by the august company I'm keeping, so I have a completely different approach to what has been said. I agree wholeheartedly with everything that Jonathan said, and perhaps look at it slightly differently, but still with the same message. For starters, I'd like to make a brief comparison between my life when I was young and that of a certain John Key. Like mine, his father died when he was about 6 and left his mother as a solo mum. He went to the local primary school and later Burnside High, and then went on to Canterbury University. One difference was that my mother actually had twice as many children as his, and she really appreciated the help she had from friends and relatives, but also from society as it was at that stage. A widow's benefit, a universal child benefit for each of us, truly free health care, and really free education. So after the local primary school and Waipawa District High School, I went off to university, again with all my fees paid, a bursary to help with living costs, supplemented by some available work during the holidays, and there was certainly no need for student loans. Not that they were available anyway. So off I went to get some useful skills at Otago University Medical School, while John Key went off to make his fortune on the financial markets of the world. So why have I brought all that up? Partly as a reminder that this is how it used to be, in case some of you have forgotten, or worse still, for the younger ones here, probably never knew it was like that. partly also to point out that some of the answers to the society's problems that we're facing at the moment actually seem to have been forgotten. I've become increasingly aware since I retired 5 years ago that many of our problems are much more economical and political, as Jonathan was pointing at towards the end of his talk. And it also seems to me that there are lots of parallels between the way medicine was conducted in the first half of last century and the current approach to economics. For those of you who aren't quite aware of medical history as I am, in the early 20th century, medicine was full of assertions and opinions. The older the asserter or the opiner, and the more grey-haired and authoritative, the better. Adding a knighthood made a truth even more definite, and if you were a peer of the realm, you just couldn't be argued with. But over the last 50 years, as you all know, we've changed in two important ways. Firstly, we've looked more for evidence-based for treatments, and secondly, we've also stressed the need to check on what we do and see whether it works or not. It's become standard practice to assess all the possible information on an issue and assess it on its scientific merits, and the Cochrane review system is really the epitome of how this works. It seems to me that economics, in a large part, is still in the position that medicine was in the early part of last century. I was recently reading a book by an economic journalist, Martin Wolf, on globalisation, and it seemed to be so full of isms I got lost on capitalism and communism and liberalism and all sorts of things. They weren't well defined, and the assertions and strong opinions from experts were also prolific, usually from professors and Nobel laureates in economics, but there was a sparsity of convincing hard facts. In fact, the impression I was given in that book is that, and in much reading, is that the markets can do all that's needed to manage social problems, and they have all the answers. All the other systems have failed and they're all bad. There's little allowance for compromise, and this I think is a problem. It's difficult to take the line that markets, while being important, need to be regulated for the benefit of all, not just the wealthy who lobby the most effectively and provide support for politicians. So where do we draw this line of compromise? It was interesting that Wolf, looking at the world economy as a whole, had, I think, demonstrated reasonably well that increased wealth overall has occurred with the current market approach, and this is excellent and to be applauded. Unfortunately, a few billion people in China, India and South America tend to obscure some of the finer detail in countries like ours. And he also makes no assessment of how the benefits of improved wealth are actually distributed, even in the poorer developing countries. So, if we do look at a situation in a single country, of which we are one, this is the sort of thing we come up with. And this slide, as you can see, comes from that same report, excuse me, from Brian Perry from last year, and it shows the equality of income, if I can use this, the equality of income on this line over a period from about 1980 to now. This Gini coefficient, for those of you who are unfamiliar with it, is a measure of the equality of distribution. If you've got a Gini coefficient of 0, everybody gets exactly the same amount. If you've got a Gini coefficient of 1, or 100% as in this case, then one bloke gets it all and the rest of us don't get anything. So mid-20s is probably pretty average for OECD countries in those periods. But you can see there's a huge jump, and this runs parallel with the graphs you saw from Jonathan on child poverty. There's a huge jump in the late 80s early 90s, up to 32%, and then it levelled out a bit. And this means a lot more of the wealth goes to the wealthy. The result of this, most of you all know, and I think this graph was on Johnson's subsidiary slides. I'll get in ahead of him. This is a graph from a book by Wilkinson and Pickett called The Spirit Level, which seems to be the driving force for many public health people and other concerned people in the community. And they quite clearly show that this inequality of income distribution is detrimental to the community. You'll see that New Zealand is up here, and we've got up there at the wrong end of that graph more quickly probably than any other country in the OECD over the last 30 years, which is a terrifying thought when you think New Zealand's a great place to bring up children. It's been the catch cry. The other thing to just note is that there is a list here of all of the items that they took into account when they made this combined index. Most of them are fairly clearly and easily, definitely measurable. You know when people die in terms of life expectancy, infant mortality, how many people you've got in prisons, how many homicides there are. Some of them may be a little bit more variable and debatable. So how do you measure trust in the community, for instance? Where's my pointer? There. The one that I'm amused at is that social mobility is less likely to happen in the land of the free, where the great American dream is that you can all improve your lot quite easily. It's less likely to happen in America than any of the other countries on this list. The other thing about this list is that for each of these individual pointers, they have the same relationship to inequality, and the same applies when Wilkinson and Pickett took the data from individual states in the United States. And again, all of these items related to the degree of equality within a specific state. And I think that's this is one team's research over a lifetime, but there's lots of other data that confirms this. And the key thing is that the social and health issues that they've delineated come from inequality of the wealth distribution and not from the actual level of wealth of individuals within the community. And that's where my personal example comes in, because in the 1950s, 60s, 70s, we used to share our resources as a society much more equitably than we do now. I regard it as recent past, some of you may differ on that, but I and my 5 siblings all benefit from the society, and we acknowledge this, but I feel at times that our beloved leader has forgotten it. In fact, when you look at the detail, all of the problems that we are currently struggling with in health today come into that list down the side there that Wilkinson and Pickett have been talking about. They've all been studied to death. We've heard a huge amount of information from Jonathan, and those 20-odd subsidiary papers that come into there have got an immense amount of good information on what happens in New Zealand. We know a lot of the problems, we know a lot of the answers, but we don't seem to be able to put them into practice. Some of the problems, just briefly, you've heard about child poverty, and perhaps I can just put a little extra spin on it. This is from a couple of Auckland researchers in the Child Poverty Action Group report, pointing out that poverty is not just lack of money, but it's poverty of experience. And I think Again, Jonathan emphasised resources and deprivation. But look at the numbers if you're worrying about money. This is work and production reduced, no tax coming in for the government, health costs, crime and justice, which all come out of this poverty, and $4,000 a year as an estimate for each wage earner should worry you. It doesn't worry me, of course, but it is a concern for all of us. And if you look at it and overall, again, comparing the percentage of GDP involved in all this, loss of productivity here, the figure they've come up with for New Zealand is within the range for the UK and USA. Crime costs, again, are within that sort of their two ranges. Health costs are similarly in the range. This UK cost actually refers only to the amount of cost it incurred up to 18 in hospital and health services. It doesn't allow for the damage that is caused at that stage that produces continuing health costs throughout life. So if you take 4% of our GDP, even my maths can run to saying that that's about $8 billion a year. You know, the new train line for Auckland and a bit of repair in Christchurch, but it's more, and in fact it's more than that, and it's happening every year, which you would think would actually strike a chord with the Treasury or somebody. The other problem is unnecessary admissions to hospital that come out that we have to cope with. The classic list for children is asthma, gastroenteritis, respiratory infections, dental troubles, and skin infections. There's a potential saving, if we got those right, of saving millions of dollars. And we've had a look at the 3 local DHBs, and for cellulitis as a result of skin infections and their admissions, here we have 250 admissions, but nearly $750,000 being spent, and that's on an annual basis. Housing, and Philippa knows far more about housing than I do, but anyone who's worked in the realm of children's health can provide a long list of families that keep coming back to you because their house is cold and drafty and wet and mouldy and overcrowded. And in fact, a study in South Auckland showed that if you improved that, 27%, there was a 27% reduction in admissions, which seems worthwhile. Overcrowding, Michael Baker and his colleagues have just produced a paper that says that 25% of the infectious disease burden in Maori and Pacifica in Auckland is due to overcrowding. So there are obvious answers. Child abuse and family violence generally, it's very fashionable at the moment, and at least a proportion, and it may well be a significant proportion of that, is due to the stress of struggling to find enough to live on and to cope with the exigencies of life. And there are other examples of where we are spending money on health unnecessarily. They all involve quite big money, and reducing these conditions is really only by a preventive medicine approach, and in this case by intervention, not just by health professionals but by society in general, changing attitudes. So back to economics. When you're retired you can read whatever you like and you don't have to stick to the medical journals. And I've looked a little bit at some of this. Free markets we all keep hearing about. There's no such damn thing as a free market actually. Everything's manipulated, regulated, managed somewhere along the line. And so we need to have the regulations in favour of everybody and not just the people that control it and the squeakiest wheels that have the biggest money. Markets also fail I keep quoting an economics historian, Charles Kindleberger, who was when he was writing in 1978, pointed out that markets failed nearly every 10 years, and for the last 400 years. In fact, looking further, someone says in fact it goes back to Egypt and the pharaohs. So markets just don't work unless they are managed properly. Remember poor old Rembrandt in the 1630s when he lost a lot of money on the tulip market when it collapsed. The other thing that I find unsatisfactory is GDP is such a poor measure of the society's commercial activity, and it doesn't measure society's well-being. And this was clearly stated by the chap who developed the concept, Simon Kuznets, way back in 1934. A few years ago, President Sarkozy of France asked Joseph Stiglitz and some friends to look at the way we measured economies, and they came up with a very clear conclusion that we need to extend it from just money to things like health and education, work, environment and employment, voluntary contribution from society, the value of family and friends, how much say we have in governance of the country, sustainability, pollution. And all of these things are what people tend to rate as important in their lives when it comes to flourishing. And this graph is from a BBC poll back in 2005. Big chunk was family and friends. Health was important. Nice place to live and fulfilling work. But look how much money came into it. A tiny fraction. By contrast, GDP is a measure that focuses on financial wheeling and dealing, and which benefits most of us very little. It also uses averages and tends to ignore the highs and lows of a measurement across the whole population, and that distorts what you're talking about. In medical terms, I like to compare it to trying to monitor diabetes using urine sugars only, which is what I used to do when I first graduated. It's a bit helpful, but it's a recipe for disaster if that's all you've got. And GDP is an equally poor way of trying to work out what's going to happen in the future. And J.K. Galbraith has a much slicker way of saying it than I could ever do. There are also areas where markets are not appropriate. And Michael Sandel from Harvard, as a political philosopher, in one of his books points out that if you put markets into areas which have got social and ethical and moral values that are needed, then you tend to increase the unfairness of things, and you also corrupt or alter the actual goods or services you're talking about. You can make schools and health services and police and justice systems and armies a market. You can put a value on them, but it actually means that the well-off people control things and they're not democratic. I think we haven't actually looked at this sort of thing as New Zealanders. We've never debated the ethics and morality of such approaches, this market approach. And I think if we don't look at this, we'll continue to go down the same path that we've been travelling in the last 30 years of what Joseph Stiglitz calls market fundamentalism. And I don't believe this has served us very well at all. So what are our answers? We're not a poor country. I think it's crap. Somehow we need to share the wealth that we do have more evenly. And the possibilities, they're all political, politics is, after all, the way that we organise our society. I've got a little note here that says, I'm definitely not talking party political rubbish. Actually, I am. I think we need to be quite open about all this. We need to convince prospective politicians and parties that what we see as important and what the population sees as important, they should heed. And I think we as health professionals have a major contribution to make in that direction. After all, in medicine we're used to complexity. We learn from the start of our training about the interactions between anatomy and physiology and biochemistry, and the complexity of these pales into insignificance when you include cell biology and genetics. Add to that the workings of the brains and emotional and psychological interplay of human beings, and we are trained to deal with, and economics looks pretty straightforward. And I think we shouldn't be reticent about adding our voice, mainly because we do know the variety and complexity of how humans behave and think. And this seems to be an aspect that economists and policy developers often seem to ignore. They see us as rational beings making decisions because we have all the information required. Yeah, right. They see us after the biggest cut for ourselves with no ideals of sharing with others. And anyway, if they get it wrong, like Humpty Dumpty, it can all be put back together again, if only. In the past, I've been accused of getting too emotional about the issues involving children's well-being. I make no apology for that. After all, the most emotional people that I seem to see are financiers who get in a panic at the least hint of a change. The old sneeze in Tokyo causes influenza in London and New York. So what have we got possible changes that we can suggest? I think the change needs to be in the tax system. We've just heard that people aren't so keen on progressive taxes, but perhaps we need to argue for them. Progressive tax means that the wealthier pay more. A regressive tax is one like GST where the poorer pay more, ultimately. Other taxes that could be introduced are the capital gains tax that we've had some tentative comments about from the Labor Party, but they're scared. One I like is a Tobin tax, which Tobin suggested for financial transactions, just taking a small proportion off money as it moves around uselessly in the wider community. Another one from my interesting friend with the caps, Gareth Morgan, who suggests a tax on capital assets, your business, your plant, equally your own home or any other houses you may own, your intellectual property. And in fact, if you look at New Zealand's history, land taxes were the only sort of tax up until about the 1920s. It wasn't there at which stage income tax came into it. So there's a precedent, and it does seem a fair way of redistributing things. The other trick he had, which I liked, was that if you keep the rate of tax the same for all sorts of things, you minimise the amount of chasing around people do, and that actually saves a whole lot of effort in the community and stops wasting money. On the distribution side of things, superannuation needs to be looked at. I often wonder actually who's benefiting from some of the benefits. Paying less than an adequate wage means that the taxpayer supplements the wages billed for a company, as well as providing a benefit for the individual worker. Living wages have been suggested, and again, this seems to be sensible. It has the double benefit of giving enough money for people to live on, and also increasing the amount of money circulating and being spent in the community. If you for say 10,000 workers, you increase their wages by $5 an hour to a living amount from the minimum amount, that would provide $100 million within the community that was going to be spent because these people are short of things and need to spend it. I suppose it depends whether you're a glass full or a glass half empty sort of person, whether you're saying that's $100 million in the community to be spent, or $100 million for the employers to pay their workers. Gareth Morgan had another idea too of an unconditional basic income where everybody, all adults, got a little bit of money. Probably you could live on it at the pinch, and that would mean you could stay at home and lie on the beach in the sun. You could stay home and look after your family. You could do some voluntary work in the community, or you could decide to go into paid employment and make more money, obviously, and live more comfortably. But this would also, if it was done correctly, avoid all the complexity of benefits and the hassle of trying to work out who should have one and who shouldn't, and the subjectivity that often implies. I think that we do need to change. I don't think we will ever manage without economic markets, but they must be limited in what they can do. They must have proper regulation of their functioning, and they should focus on all of society and not just small, powerful groups of lobbyists. We need to push for big changes, not just fiddling about in the edges, but that's important too. And this needs widespread support from society, and I think we need to go and try and push for that. And my last thought is a quote from Yeats, and I would suggest that we do need to have convictions and be strong with them and push them, and possibly even, very much definitely, use some of the passionate intensity that he talks about as well. Thank you.
Question. From the meetings that you've had around the country, what would you say the appetite is for a widespread implementation of the living wage? I'm thinking about the groups, the community groups, the governmental groups, the policy groups that you're involved in, as well as the expert advisory group.
Well, that's quite simple to answer. I can't answer it because the issue of the living wage barely came up in any of the meetings I've been involved in. So meetings I was focused in on were on child poverty specifically. The living wage was occasionally mentioned, but not very often. And we specifically said in our report that we did not favour a significant increase in the minimum wage as an instrument for addressing child poverty. That means that's not against increasing the minimum wage, but we said it wasn't a particularly useful way of addressing child poverty, partly because simply increasing the minimum wage, if you didn't make other policy changes, would actually deliver very little additional assistance to families, because many low-income families, of course, are already getting various forms of supplementary assistance. And those supplementary forms of assistance would begin to bleed out as you increased wages. So the net gain for many low-income families would be minimal.
We discussed this morning actually having a living wage as part of trying to encourage the university to take the lead here. So I think institutions have got a role as well as people. But questions aren't addressed to me, sorry.
I'm Ben Gray from the Italian Health Service in the university here, and I seem to have been listening to you, Jonathan, at various meetings. And the one earlier on was launching the book about inequalities, which Philip was also at. And my question is really that child poverty is sort of sexier You know, no one can agree, no one can say it's really good for children to grow up in poverty. And I guess that's the reason why we should focus on child poverty. But my sense is that we won't get very far in the longer term on child poverty unless we deal with the income inequality issue, and that the risk is that we'll have responses like some Weet-Bix and milk in schools, which isn't a particularly bad thing, but could lead to things worse if it's not backed up with a range of other things. And that they'll do, which is what they're probably in part doing already, which is sort of kick off policies which mean they get some runs on the board and say we care about child poverty, but that actually nothing much changes, because actually most children live in families who have unequal income.
Well, Archie might want to comment on that as well, but let's be clear about a number of things. First of all, poverty and inequality are two different things. They're measuring two quite different things. So if your poverty measures, if you're using income measures, are based on your proportion of median family incomes, say 50% or 60% of median household disposable income, then you can have quite low rates of poverty and quite significant levels of inequality. It's interesting, in Sweden over the last 5-10 years or so, child poverty rates haven't gone up, but inequality has gone up very considerably. Now, you might think, well, hang on, what's going on here? But it's quite simple. I mean, the authorities in Sweden have ensured that income support arrangements are such that they are keeping low-income families above the relevant poverty lines, or the majority of low-income people above the relevant poverty lines. So the proportion of children in families who are in families with incomes less than that, say, 50% or 60% threshold hasn't gone up, but incomes further up the income hierarchy have obviously increased very significantly, therefore widening income inequality and increasing, the Gini coefficient. So that's the first point to make, that we are dealing with two separate things, and you can have lower rates of poverty if you want in a context actually of increasing inequality. I mean, generally speaking, the two are going to go somewhat hand in hand, but there are paradoxes here, and indeed, I don't know if Christy Carter's in the audience, but Christy's written a paper on that, which we published in the latest issue of Policy Quarterlies, which I've got, so anyone particularly interested, it's all laid out quite clearly there. The second point, which is perhaps more significant really from a philosophical point of view, is, okay, what are your principles of justice that you're wanting to achieve? What kind of society do you want to achieve? What's the good society? What are the ends, the outcomes we want? And in that regard, obviously, Ben, the nature of your answer is going to depend on your approach to what is just, what is fair. For my own part, and I've written, as you know, a chapter in the book on inequality, I'm a specific egalitarian. So I take the view that the aim shouldn't be just to sort of equalise everything, as if equalising everything somehow is the best thing to do. So it's not just about reducing inequality of any kind. We should be focused on those types of inequalities which really matter. So, health inequalities clearly matter. Not having reasonable equality of educational opportunity really matters, because that then affects social mobility, it affects the capacity of people from poorer backgrounds to achieve the sort of thing you were able to achieve, etc. So I think we should be focused very specifically on those forms of inequality which are unjust and which have damaging consequences, and seek to reduce those. In the New Zealand context at the moment, I mean, my personal view is we would need to do quite a lot, because it's very clear we have some very significant inequalities in healthcare outcomes, educational outcomes, housing, absolutely, and to even to begin to make some significant progress there would require very, very substantial policy adjustments, including on the income and tax side of things, in my view.
Archie, do you want to?
Yeah, I'd agree essentially, although I think the overall income inequality it's got to be the bottom line, so I agree with you. A lot of our benefits, they start to abate as soon as you start to earn a bit of money, and there's a whole lot of problems with those. which is a disincentive to even go out and find some work in some cases. The other problem is that there's a feeling amongst people who have wealth and power that their own efforts have actually achieved their wealth, and that's actually not entirely true. There's a chap, Herbert Simon, in the 60s, who calculated that about 80 or 90% of a wealthy person's wealth actually came from the infrastructure and security and the society they were living in, and only a tiny amount was actually due to their own efforts and probably good luck on top of the efforts. So I think when people say, look, I made my money on my own, self-made man is an anathema. It's not really true. So I think we as a society have in the past had a much better way of distributing things. I think wealth money does come into it, and in fact Professor Greg Duncan, when he was here at the end of last year, one of his talks, he made reference to a study in the States where families were given $3,000 a year for a few years, and children from that situation, it was primarily, the big news was it was spent on the kids and families, by most of the families, and it also meant that the children, when they grew up, actually got a better income and were more involved in society later on. So I think money does come into it, and I think I agree that you can increase the inequality and not increase poverty, but I don't think we're doing that at all in New Zealand.
But if I could quickly comment, Archie, again, there's an article by Greg Duncan in the latest issue of Policy Quarterly, specifically on this very point. And he highlights that giving low-income families additional income does make a difference on a range of fronts. Giving middle-income families more money, or giving people more money further up the income hierarchy, doesn't actually make much difference. So it's actually highlights the importance of helping the poor.
Thank you. Some other questions? Up the back here. Yeah.
Hey Tom, Jeremy Tui here, Department of Obstetrics. Jonathan, you make it very clear that there's lots of different ways of measuring poverty, and also explain that the government doesn't appear to actually want to measure poverty. In the spirit of the soundbite, we know that on Morning Report, you're only going to be given one number, and you're not going to be able to go into the different sorts of poverty which may be present. Do the non-governmental agencies involved in child poverty have an agreed primary indicator at least, so that when people are talking about child poverty, we're not going to be bamboozled by the fact that, oh no, the rates have gone down because we've just changed the way we changed the way that we looked at it. But we can all talk about the same thing and see whether or not there have been any changes.
Well, look, others here may wish to comment on this. Look, my personal view is quite firm. There is no one right measure of poverty. And we need to have a basket of measures because each measure is going to pick up something somewhat different. And one of the reasons for wanting to sort of emphasize that is that internationally there's no one agreed measure. Whether it's 50% of the median household disposable income or 60%, or whether it's before housing costs or after housing costs, or whether it's an income measure or deprivation measure, there is no one sole agreed. And there's a very, very good reason for that, because there's no one, obviously, absolutely preferable measure. So in the absence of that, and I don't think that's ever going to change, we need to argue for a mix. When the British Parliament passed its Child Poverty Act 3 or 4 years ago, it quite specifically identified 4 specific measures of child poverty, which includes income, deprivation, severity, and persistence. And I think that's a very good way of thinking about it, because each of those measures captures something different which matters. If that means we have to sacrifice having one number you can use on Morning Report, well, tough. Sorry, I mean, I don't want to compromise integrity for some sort of, whatever. symbolic gain or something, I don't know. But you know, I want to underscore the fact we do need, you know, authoritative measures. I'm disappointed the government hasn't taken up our proposal that we should have agreed measures. Thankfully, they're still allowing Brian to do his work and to publish it, and they are therefore having to respond to his, you know, regular reports when journalists ask them about these measures. But I think having, you know, established authoritative, ideally official measures would be very desirable. And there's one final point. Sorry, just it is really important that we understand that we are measuring on the income front against the median income, not the mean income. This also helps explain why you can have, for example, rising inequality, but no increase in poverty, or in fact, reduced poverty in the context of increasing inequality, because you're benchmarking against the median income, not the mean income. And that's really, really important to understand, because and it's unfortunate that, you know, many of us senior policy makers don't understand that. So you constantly hear people saying, well, we can never, you know, reduce poverty very much, because if you increase the incomes at the bottom, well, that means simply pushes the average up, and well, you know, you're back to where you were. Well, I mean, that's not what you're doing. You're increasing people at the bottom against the midpoint, not against the mean.
And just before I pass over for Archie for a quick comment, I mean, I think it's really important. We've been talking mainly about income, but although we don't measure very much wealth, the graphs you would see for wealth are even worse. And having gone to a retirement dinner, people not very far away from here, there's some sectors of society that get rather large retirement benefits, and other people who are laid off with nothing. So there's a huge difference that comes as people retire.
I was simply going to raise the question of median. I suspect most of the journalists and politicians don't understand the difference between a median and a mean, and that's uphill work again.
They don't. I mean, we had last year the editorial in the New Zealand Herald making this very, very mistake. I rang them up and said, you know, please, you must understand that there's a difference between the mean and the median. And after a while, I managed to get that point through. And the person who wrote the editorial said, "Oh, we should put this right." But well, they never did.
Another two. Vera?
Yeah.
Can you introduce yourself?
Oh, sorry, I'm Karen Cook. I'm in public health here at Victoria Wellington. Just one breakdown by Richard Titmuss, a very great anti-poverty campaigner, said in 1960 that the middle classes were moving their wealth out of income and into areas that are not accessible to tax. So I think we really have to think about increasing equality and measuring increasing inequality by means other than just measuring income. But what my question was, when you go around and talk to people, because you both obviously have been talking to many New Zealanders, do you feel that they're getting the message? Because they're still voting for a government which is doing the opposite to what you're, I mean, in terms of independent policy and so on. Do you think any of this is getting through?
My sense is that the New Zealand community has, you know, a wide range of views on issues around child poverty and inequality and what its causes are, what its consequences are, and so on. Some of those views are clearly, you know, very ill-informed, some of them are very well-informed. But my sense is that the community is quite divided. So, you know, I wrote an article back in September, October for the New Zealand Herald, which was entitled Three Myths Around Child Poverty. There were about 500, 600 responses, I think, within 24 hours on the blog. And you know, it was probably 40%, 60% generally supported, 40% not. Not many people in between. And some of the, I brought some of the quotes along. I mean, some of it's absolutely delicious, you know, in terms of what people think on both sides, if you like, of the fence. But you know, there's an awful lot of people out there who don't think there's much child poverty in New Zealand, if any at all. That if there is, it's all the parents' fault. You know, They're wasting the money they get. They're spending it on booze, gambling, sex, whatever. They're having too many children. Classic statement was, the more they breed, the more we bleed, we being the taxpayers. All that kind of stuff. And I mean, what is even more striking is that people say that to you in public meetings as well. Question at Otago University in Dunedin when I was down there last year was, Professor Boston, have you been to Northland and Central North Island and the East Coast, and have you seen how they produce? I wasn't sure if they were talking about the cattle or the people. I mean, that was in a university lecture theatre in Dunedin. So, well, of course, I mean, there is a genuine issue there. I mean, some people are having children that they cannot actually support, and certainly cannot support in terms of the range of income assistance that's available at the moment. So, what is our response to that? I mean, these are real issues that people are seeing with their own eyes, and we can't just dismiss them. But they also provide a very strong frame for the way people think about things as well. And so there's a lot of blaming out there, and not as much charity or compassion as one would like.
Okay, another couple of quick questions and then we must call it. Oh, okay, and then there's a person at the back there. So two more quick questions.
Just while we're waiting, along that line, I get a bit despondent. I've got a colleague who's an ophthalmologist, and I've had a heck of a job persuading him in our discussions that poverty for children is a real issue, and it's not all their fault. So it's uphill.
Hi, my name is Arfina Thompson. I'm from the Ministry of Health. I just have a question about, well, actually it kind of leads on from what you were saying. In terms of social problems, a lot of them are rising out of income inequality, including health and crime and so on. How do you affect real change in terms of child poverty and other social problems when the government and society in general is really tolerant and has accepted the level of inequality and the way society is structured? How do you actually make a difference when nobody really wants to go there, and when it comes to taxation and stuff, it's so unpopular? How do you affect a change in terms of the public as well?
A couple of quick responses.
Oh, well, look, I mean, I think, as I said right at the end of my lecture, we need good evidence to highlight the consequences of living with the sorts of poverty levels and deprivation levels that we have. We need people who are prepared to articulate that evidence well in public. We need adequate political leadership. We need to essentially seek to persuade and change public opinion. Without the evidence, without the argument, without the leadership, we're not going to make much difference, it seems to me. You need all that collectively and consistently and over time. I mean, I suppose my hope would be that more of the senior politicians in both major parties would begin to take more of this evidence seriously. I mean, I'm heartened that the Prime Minister, on some of the recommendations that we advanced, has sided with us rather than some of the other members of his party, because clearly there was a very strong argument, in the cabinet and the caucus about whether or not the government should provide more money for food. I mean, for more money for food in schools, and clearly the Prime Minister decided those who said yes, we should, even though there were lots and lots of people who were saying, well, why on earth should we be providing food? It's parents' responsibility. We shouldn't be doing that.
Jonathan, should we? Yeah, just can you make a very quick and then final comment from both people, and then we should finish.
Ross Wilson, I'm a paediatrician here at CCDHP. Just partially alluding to what Jeremy was asking about before, and some of the other questions, that to get the story across, don't we need to use more stories of to actually have more of an impact for people? I mean, here in our department, one of our case presentations 2 or 3 weeks ago, we heard about a girl who had chosen to eat less so that her siblings could eat more. She was presenting with malnutrition to our department And that's not a story you can tell in public, because to do it is to identify individuals. But we do need to tell stories of the deprivation that children live in, because for a lot of people, arguments about median or mean, or the evidence base is, although it has to be there, it doesn't actually have an impact, and individual stories can do.
Yes, so I would see the individual stories as part of the evidence.
Thank you. A final, anything you want to say, Archie, or you?
Well, to go back to the Catman again, Gareth Morgan produced a book a couple of years ago, and basically saying we should relook at the whole way we collect taxes and how we collect taxes, and also how we redistribute those and transfers of benefits to the population. And even further back, there's a question, is that the sort of society we want? I think all of those of us here will say yes, but not everybody in society feels that way, and we need to persuade them on that as well, that we need to share things.
Thank you.
All right, one final comment. War is a wonderful leveller. Literally, I mean, we had the lowest levels of inequality in the developed world, certainly during the 1940s, 50s and 60s, and it was a direct result of the Second World War. I'm sorry, that's a slightly flippant comment, but there is absolutely no question that certain massive events that from time to time have very profound effects do shift opinion for long periods of time. It's possible that the global financial crisis is yet to, in my view, work its way completely. Who knows what's in store? But in the meantime, I would just say, yes, we do need the stories. We need the arguments of various kinds, at various levels, and we need to make them, fulsomely and persuasively. Thank you.